Hey everybody, it's Melissa Fasseldon with the Milton Scene and Milton Neighbors. I hope you guys are having a safe and healthy evening. And I'm here tonight with Milton Neighbor and our state representative, Bill Driscoll. And we're going to talk about what's happening at the state level and all things COVID-19. Before we get started though, I want to introduce our sponsor, Fitness Unlimited. And I want to tell you about their virtual membership. The mission of Fitness Unlimited is to empower you to live a healthier, happier, and more balanced life, which we all need right now. We want to make sure that you are armed with the tools to improve your life. The club may not be open, but our mission will never stop. So for only $30 for the month of June, you will receive access to virtual classes, both live and on demand. And right now there's over 150 videos in the library and they add new ones every week. Our instructors and personal trainers are creating new videos to keep you moving, motivated, and reaching your goals. And it's so important right now to keep moving, and it also keeps us sane, right? So you're also going to have access to their private Facebook group, which features inspiration, nutrition tips, classes, and more. And you can sign up today through fitnessunlimited.com. So thanks again to Fitness Unlimited, and welcome Bill Driscoll.
Thank you for having me.
I'm so happy to talk to you today. I wish we were talking about more pleasant things. So before we get started with some updates from the state, what are your and your family's current practices during the pandemic? I know you have two young sons. What's going on with you guys right now?
Yeah, thanks, Melissa. Thanks again for having me on. It's a good question. I think that kind of modeling behavior is important in this day and age, the last few months. So we are about as strict as you can get still here at the Driscoll household on Adams Street in Milton. We are not taking this lightly. And we haven't left the house too much in the last couple months. Where everything that gets delivered to the house, we are letting sit as long as we can out in the open air, and then washing it as it comes in, if it's, food related or otherwise. And we're looking at, the school year ahead, which, we'll talk a little bit about. And I've got a 1.5-year-old, Robbie, and a 4.5-year-old, Will. So Will was in a pre-K program. Robbie was in a home daycare. And obviously they've been out of that for the last couple of months. So my wife and I both work full time. So working from home and trying to carve out the day into different time chunks. And it works great some days, not as great on other days. In terms of, typically Wednesdays are pretty busy for me with things going on at the State House, so to speak, virtually. And it's, I'm helpful in the morning and then not so much the rest of the day into the night. So I'd have to make up for it on other days. But a lot of tag team and in and out. I need an hour here. I need 2 hours back and forth between the two of us. So it's been a learning situation like everybody has gone through, and trying to perfect it as much as we can, which I'll talk about more as we go. But yeah, we're staying home. We're wearing face coverings when we go out into the front yard, right on Main Adams Street, which is the main street in Milton. So we have hundreds of people a day walk by, which is great. A lot more people out on bicycles now, getting some exercise. So the backyard, most of the time we are walking around like we normally would 6 months ago. But if grandparents come by, we are staying physically separated, distant from each other, and wearing face coverings and gloves and eyeglasses. And so just not something we want to mess with and continue to suppress the spread.
So on a scale of 1 to 10, you guys are at like an 11. You're like model citizens. You're doing a great job.
We're trying. Yeah. Hopefully we can stay sane as possible in the future here. It's, the little guys have been pretty accepting of it. Robbie at 1.5 has no idea what's going on. He's just happy everyone's around. A little clingy, more screen time than anybody wants to admit.
Yep.
On some days, but Will's been pretty good. We did some early. I really encourage people to, if you haven't already, watch some of the videos that are out there. Read some of the websites around talking to kids about what's going on. and that was really helpful early on. And we've continued some of those practices to ask Will about what he's hearing, what he's thinking about, and being, age appropriate, but pretty forward with him about, we refer to it as the germs that are out there and at different times. And he's pretty understanding, and, he's planning play dates in the future with friends and
so cute.
relatives, when things are cleared up. So he's thinking about that, making plans, but he's pretty accepting so far.
That's good to know. I mean, to be blissfully 1.5 right now would be really great, wouldn't it?
Yeah.
So, I mean, last weekend was amazing. It was so beautiful, Memorial Day weekend. And you probably noticed and heard about on the news that a lot of members of our community, as well as really the entire country, are refusing to adhere to certain standards, the masks and the social distancing, wearing masks within less than 6 feet of someone else. What do you think is contributing to people kind of not being on board?
Yeah, it's a good question. Something I think about a lot, just in terms of how to continue to message around, being responsible and looking out for each other. First of all, everyone's situation is different. There are folks, I can work from home at this point. We've set up the ability to vote remotely, to hold public hearings remotely. Other people, need to be physically present at their jobs. And so that, there's obviously different degrees there that you have to, pay attention to. But one of the things, we just passed officially 100,000 people have perished because of COVID in the United States, which is just, tragic, really tough to comprehend and think about. And what's even stranger is we know it's an undercount, just because of the quote unquote, what's referred to as the excessive death rate in each state. There's an average number of people that pass away every January, every February, and so forth. And all those numbers across the board in the United States have been, higher. So, looking back, this will be, in terms of how we looked at Puerto Rico after the hurricanes, the initial death toll was very undercounted. And then about a year and a half later, the experts looked at the data and kind of came up with a better estimate. Yeah. So we know it's an undercount. We know we still have to go forward. And because it's a rolling disaster, this is a 50-state event, it's a worldwide event. We're not mourning in the same way. We're not doing the same rituals. So you think about, for those of us that went through 9/11 or the Boston Marathon bombing, these kind of major events in our lives as Americans or living in Greater Boston, there were instantly memorial tributes and things that are carried on to this day. In some places like New York City, they're doing a weekly memorial over a video, which is pretty unique. And they're, where they're showing names, and they have musicians come on and play songs to remember the folks that have passed away, that week or recently. And I went to my first funeral over Zoom for a buddy from high school that passed away. And it was good in the sense that I got to see, friends over video that I hadn't talked to in a while, and that kind of reunion sense. But my word of caution for folks, if you haven't been on one of these yet, is the thing just ends at the end, like, leave meeting, so to speak, in terms of the vernacular for the software. It just was bang, that was the end of the service. And that was really tough. And called one of my, college roommates who was friends with him as well. And he's like, I'm so glad you called me. I didn't know what to do afterwards. But the point being that these things, whether we've been affected, I know lots of people that have had the virus and had a mild case and been okay in the end. Very thankfully, not many have had a tougher case. And I think that's the same experience a lot of people have had. So it hasn't directly impacted us. And that certainly is important when we're talking about adherence to or adoption of different standards. I think the longer we go on and we're not directly impacted in our personal networks, there's a sense of complacency or exhaustion, frankly. I mean, I think we've all felt the burnout factor of working from home or not being able to go out too much, and living in the space, whether we're alone or with 10 people in the house. There's different dynamics at play, and so the news is exhausting, in terms of the statistics and different things that are out there. But I really think that we have to understand, here in Massachusetts, we're trending in the right direction in most of the categories, which is great news. I think there is a way out of this, but it's really, really important to understand that we don't know a lot about how the virus behaves, how it transmits, that we're still, very much in process of studying this, the infectious disease specialists and so forth, studying this to try and get to a point where they can say, here's the best course of action around working back in our brick and mortar places, or going out socially. So what you've seen is pretty much today, the Boston Marathon was canceled. It had been postponed to September. Every major event, anything that's a large scale gathering, I think will continue to get postponed or canceled up until probably the end of the year, because the early data is showing us that folks that end up being super spreaders, so to speak, that walk into a crowded space, like the Biogen in Massachusetts, which was really the big driver of our kind of launch into COVID, is exactly what a large scale gathering, whether it's a work conference or a sporting event or what have you. And so just, again, being cognizant of that we're all responsible here to help suppress the virus. And I think that just gets lost over time. While we're creatures of habit and we've been able to adopt this stay-at-home mentality, we also want to make sure that we continue the kind of personal hygiene protocols in terms of washing hands. And the thing that I've, again, said to my family and friends and my colleagues at work is go above and beyond the guidance is one of the ways that we've thought about this. At my house, it's, 6 feet, stay physically distant. If 6 feet is one thing, then, go to 10 feet, go longer. If someone is not covered up, a sneeze can travel. The super sneezers, as Dr. Fauci was talking about weeks ago, 27 feet.
That's totally my husband. He is totally a super sneezer.
It's allergy season, and so Pete is, you gotta watch out for Pete. But but that's just, while that's not the norm, not everyone is a super sneezer. It is something to be aware of, because you can be doing everything right, and it just takes one mistake when you're out in public. And so, again, limiting our exposure for yourself and limiting for others, because one of the scariest things about this is that it's this idea of the asymptomatic carrier.
It's terrifying.
It's terrifying.
You might be one. It's terrifying thinking you might be one.
Exactly.
Or have been one.
Have been one. Very concerning. And so I think that because it's not like the flu where you have symptoms, almost immediately in some cases, or within 2 days, it's really tough. I think initially, a lot of us have wrapped our heads around now what asymptomatic means.
Right.
But it's also the idea too of trying to wrap our heads around. So everything right now is trending in the right direction. Like I said, I think there's a way out of this, so to speak, in terms of a phased in reset, coming out of the lockdown, so to speak. There's a lot of good work going on in the pharmaceutical world to develop therapies that can dismantle the virus, or vaccines that can help prevent it. We're still ways away from those being, deployable, so to speak, in the mass.
Yeah.
And so it's just really upon us that while things are trending in the right direction, we want to make that trend line bottom out into the ground.
Right. There's no need to, there is a fear that if we get a little bit too careless or comfortable, it'll end up.
Yeah, and there's also, if you talk to the governor or Mayor Walsh in Boston, if you watch their press conferences in any degree, whether it's every day or every couple of days, there's this idea of this notion that there could be a second wave, and it's probably in the fall. And so I'm part of this working group for the House Representatives for COVID-19 that was convened by the Speaker of the House. And so I've done some like real deep dives into, various literature, past reports, and this current notion that there could be a wave in the fall. So where does that come from, and why? So the idea is, if I could boil it down for folks at home, is our travel patterns, whether it's in this pandemic state or in our state last summer, our travel patterns, our social patterns change in the summer. So we're generally like out of school if you've got school age kids, or you're traveling to a vacation destination, to the two easiest ways to think about this. Mm-hmm. And we're outside a lot more. The weather's nicer, et cetera. And from what we know at this point, the virus, it's tougher to spread when you're outdoors. Mm-hmm. It just dissipates, it just dissipates in the air. When you're indoors, so when the weather gets colder, like in the fall and winter, you're indoors more. And that's where the notion of there's a very real possibility that we see a climbing again of cases as people go back to their quote unquote fall pattern of travel, of working, of school, et cetera. And we're just indoors more because even if we're at home, it's going to be cooler out. And so confined spaces, places where the air doesn't travel as well, and that's any building, no matter how many windows there are. So that's where that comes from, if you're wondering why people are predicting that. And again, it just gets back to how do you safely reset in any number of settings indoors. And that's one of the big questions, how is this spread? What's the common denominator, that kind of thing. And we know some things, but a lot of it's kind of inconclusive, so to speak, because there just hasn't been enough time to study.
Yeah. So in terms of the numbers right now, I know you said that we're trending in the right direction. What are the COVID-19 numbers looking right now in terms of just people who have it and hospital stays and ICU beds?
Yes. So when I was looking at this before we came on, we're just over, I think it's like 2,200 people are currently hospitalized in Massachusetts. We're still,
wow, that's still a lot.
Still a lot. We still have got over 500 people in the ICU. That number is a slower trend down, the ICU bed. Other things are continuing to trend downward, which is good. Our peak was kind of that April 21st range, and the phased-in reopening that's been laid out by the Baker administration, I think, will continue to kind of hit their marks along the way in the coming weeks. So again, that's a very positive thing as long as we continue to be safe in our own ways, as people get out and move around more. And so the hospitalization, they've announced, I think today, that the Boston Hope Hospital at the Convention Center in South Boston is starting to, they're no longer accepting new patients. They're going to ramp down. They're going to leave the structure in place. Again, there's no plan for mass gathering. So the Convention Center is basically dormant for the time being for what it's usually used for. They're going to leave the setup in place, again, presumably into the fall, should it be needed again. And we just have to keep testing. It's, continue to ramp up the testing capability. Massachusetts continues to be one of the biggest testers, so to speak, in terms of volume in the country. But the range varies. A couple of days ago it was about 4,500 tests. Yet today it was 10,000. So it's kind of all over the place.
And what's that like, the testing? Is that arbitrary testing, or is it testing symptomatic people? Can you go into that?
Yeah, my understanding is that most of it relates to if you have some kind of symptoms that your primary care, you call your primary care, they direct you to a testing site. You need to have an appointment to go.
Okay.
And so you want to make sure you call your primary care ahead of time, and they'll locate one, hopefully nearby. Or it's you were notified through tracing, contact tracing, that you were in close proximity to, made contact with someone who has since tested positive. So some of the tests are those individuals that may not be symptomatic at this point, but the duration of contact that you were, around somebody that has since tested positive, it's a good idea to go get tested. So there's still not as much kind of like sequential testing, so to speak, in terms of I'm going to test it every 2 weeks, 3 weeks, that kind of thing. If I'm asymptomatic, that's not really happening for the general public. And I don't know if or when we'll ever get there, frankly. Right. But it would be great. It would help, again, kind of enter into more commingling, so to speak, with our inner circles and, greater family units, and family and friends. But right now it's really still reserved for people that are symptomatic or we're in proximity to somebody that is.
What about antibody testing? Do you have any info on that?
I've been reading up on that. It's still, there was a test done in Boston, in some of the parts of Boston that showed kind of pretty low rates of antibodies. The general word on that right now is it's still pretty inconclusive. The kind of fail rate, so to speak, or inaccuracy rate is still too high.
Okay.
Too much stock into it. So that's the early read. Again, it's still early, still being developed, my understanding.
Yeah. And when you talk about the, you just mentioned a second ago, the tracking, can you get into like how that works? Because I'm even still a little confused about that. Like, how does that whole process work? So like, for example, if I got a phone call that said, you were at the fruit center a couple weeks ago and there were 12 people with COVID-19 there, just something like that. How does that whole system work?
Yeah, so it's a good question. We're really fortunate that in Massachusetts, we got this up and running pretty quickly. We leaned on, full disclosure, my brother works for Partners in Health. My brother and my sister-in-law used to work for them. But
that's handy.
It's handy. It's been helpful too in the home protocols. My brother, having gone to Sierra Leone and Liberia after Ebola, has been helpful to bounce ideas off of him and have him tell me what kind of Ebola level standards are. But we're lucky to have Partners in Health in Massachusetts. So they've dealt with these epidemics mainly in parts of Africa. But contact tracing, again, we're trying to suppress the virus, the spread of the virus.
Right.
And one way to do that is to isolate folks that have come into contact with it potentially or confirmed and definitely have it. So it's kind of, there's a number of different types of folks where you want to quarantine them, and contact tracing plays a big role in this. And so if we were interviewing one-on-one in the studio someplace, and then one of us came down with it, we would get a phone call to say, who have you been around in the last so many days? And then the contact tracing team will then go and try and find those individuals and ask them the same questions and give them instructions on the steps to take at home to quarantine for 14 days or 3 weeks, whatever it might be. So again, kind of enhanced protocols around personal hygiene if you're living with other people. But this is a really key thing. So the Partners in Health model that they brought to Massachusetts is now being implemented across the United States in a lot of different states.
Wow.
So the federal government has asked that the Massachusetts model be implemented other places, which again underscores that this is without kind of a medical therapy or vaccine. Isolation and suppression is what we need to do to stop the spread. And so, it's important to pick up. There's billboards right in East Milton Square in terms of the numbers to, if you get one of these phone calls, pick up, because it's about a 50% hit rate right now in terms of the contact tracing team calling people and actually getting someone live on the other end of the line to answer the questions and to be alerted as to what's going on. And so that's a key part of it. The good news is that most people have been staying home. And so the number of contacts, the average number of contacts is 2.
Wow.
So that's, as long as that's a real number and not just someone saying I've only talked to 2 people and they've actually talked to 20, we have every reason to believe that they're telling the truth. That's great, because again, we're suppressing the spread. We're taking things seriously. And this is key to, the next year or more, continuing to keep these practices in place. And and to support them. And so I think we're doing the right thing in Massachusetts, and certainly there's a lot of other people that are looking to us for the answers.
Yeah, I mean, that's great that we seem to be doing a pretty good job and that we're also taking the lead on this, which is, you know, yay us in terms of being the leader of the contact tracing methods. Um, I had another question about that, but I just forgot because of my COVID brain. So when we touched about the school year a little bit ago, as the school year winds down and in light of this potential second wave coming in the fall when we all go back inside, do you know what the current ideas are being talked about right now, kind of on the general level, about strategies for combating the spread of the virus in schools, and what classes in schools might look like this fall?
Yeah, I think I want to preface it by saying that I know Milton's looking at this, the superintendent and her team, and each individual school is looking at their building. So I'm not going to talk specifically about Milton,
Right.
but generally in terms of the Department of Education, the Secretary of Education, Secretary Pizer, we held at the state level a roundtable discussion with the chairs of the Joint Education Committee, and we had those individuals come in. We had other folks in the education space come in to basically testify in terms of what they're looking at, what they think the way forward is. And so if you take one thing away from this conversation that we're having tonight and the viewers, it's this. So this pertains to school and work, physical work going forward, is that we all need, as much as it's painful for some of us, certainly, and I feel that pain, we all need to basically perfect our work from home or learn from home setup as much as possible. And the reason is that because whether schools go back at a diminished physical capacity in terms of limiting the number of students in a classroom at one time, or not, or at different times of the day in terms of staggered schedules, at any point, the reality that we're living in is that what we just talked about, you get a call from a contact tracer to say you need to go into quarantine personally. And you may never get sick, and we hope that you don't, but you're going to be told to stay home from work, to stay home from school. And so you're going to, in most cases, probably still work and still try to learn. And so you need to be able to access remotely. So I think that for schools and for work, that's one of the big challenges right now is how do we treat physical presence and digital presence equally, and in such a way that one person might be physically in the classroom or 40 or vice versa. Because the other thing to understand is that if we do have a second wave, or there's some kind of what's kind of referred to as like whack-a-mole hotspots, Western Mass may go into somewhat of another kind of stay-at-home order versus the rest of the state or the rest of the country. Again, it's going to be what's referred to, again, whack-a-mole pop-ups.
I played that video game in like.
We played that video game, right? So we may all be told to stay home again for 2 months, or individually at different points for 2 weeks. And so the idea that just be able to toggle between a physical presence and a digital presence is really, really important for at least the next year, at least the coming school year. And schools are going to weigh different options. My wife, Becca, she grew up in Winchester. When she was in school as a kid, Winchester downtown flooded, and the school building was closed for weeks. And then when they came back, they went to a staggered schedule. So she was the afternoon shift. So half the school kids went to school for so many hours in the morning, and the other half at the other end of the day. So all these options are being looked at by each individual school district. They're being looked at by the state level, because again, it's this idea that when you're indoors, it seems like what we can tell right now in terms of the studies, the early studies, is that the transmission is greater inside.
Yeah.
And we're obviously trying to, balance that. So I would say if we do get to the point, and I think we will, where people are in school buildings or are in workspaces again, offices, certainly there's a plan over the summer and the phased-in approach to open up offices in the state. It's going to be a lot more plexiglass at different points where you're interacting with reception, or kind of like high traffic, foot traffic areas, so to speak. And I know that that's being looked at in other countries as well in terms of how do you not only physically separate the desks, but then what kind of barriers do you put in place?
Yeah.
And so it's a brave new world. Again, as you could tell, my personal view on this is to kind of be more cautionary.
Yeah.
I think it's an easier stance to take in terms of trying to walk things back later, and obviously, or going too far. But economically, we are in a very bad spot. But it's been in the name of safety at this point, and so we're going to deal with the consequences. We're at a $6 billion deficit probably for the state budget in terms of revenue, and I know a lot of us are watching kind of the next earnings quarter, so to speak.
Yes.
On Wall Street, because that's really going to be a telltale sign in terms of how long this is going to take to come out of economically too.
Right. Speaking of economics, can you talk a little bit about, because I never personally knew a whole lot of the reasoning behind the census. I am like census dumb. So, you recently educated me about some aspects of the census that I didn't know about. So could you explain why the census is important? I know there's a lot of different reasons, but how one of them is actually an economic reason?
Yeah, absolutely. So fill out your U.S. Census if you haven't already. You've probably been getting mail, and you can go online to the website. Just search 2020 Census, and it takes a couple of minutes. But this is the way that federal dollars flow into communities. So flow into Milton in terms of how many people do we have living in the town. For 10 years. So this is done once every 10 years. It's super important because it dictates federal dollars to each municipality. And so we don't want to undercount in terms of if you have kids living in your house, older adults, you can't count the pets, unfortunately.
Darn.
But if someone's in your house, you want to put them down as a household member. And it's just super, super important. For the other towns that I represent Milton and Randolph. Randolph is hovering just below $35,000.
And what does that mean?
35,000 people. If they go over 35,000 people in the next census, it's going to mean millions of dollars because of the makeup of the town in terms of demographics, education level, number of immigrants living in the town. They're going to become what's referred to as a gateway municipality. And so again, Milton's not in that same bracket, but every single person's counted, basically gets attributed these different algorithms in Washington, whether it's transportation money, education money, et cetera, that come into each town. And so it's just key while we're all at home, go dig out that letter or go onto the website. And if you have the letter, it has like a code. Basically, you type into the website. If you've lost the letter, that's fine. You can get a new one on the website, and just make sure you fill out that census.
And it takes like 5 minutes.
Right.
And I know, like for me, I know for our family, the letter couldn't have come at a worse time. It was like right in the beginning when everything was so nuts, and it sat in a pile, and then I got a reminder because it sat in the pile. But I did finally fill it out, and it took 5 minutes. So.
Yeah, it's really key. Yeah, it's once every 10 years. So
yeah,
spread over 10 years, it's like 30 seconds.
Yeah, it is. It really is. So the other thing I'm hoping you can give us an update about is the upcoming town election, the primary, and the national elections, of course, this fall. I know there's been a big push in terms of town to get your absentee ballots in should you choose to vote that way. I just sent mine in. Can you talk a little bit more about that?
Yeah, absolutely. So I sit on the election laws committee at the State House, actually the vice chair. I was talking to Chairman John Lawn in Watertown a little earlier tonight, and he's right now working on the legislation for our statewide primary in September 1st. And then our general election in November. So I can talk a little bit about that. But in terms of the upcoming election, yep, your ability to get an absentee ballot from the town is still out there, and you can mail that in. So if you don't want to physically show up to your polling place on the election day, you don't have to. You can still vote by mail, and so that's really good news.
Yeah.
What we're looking at for town meeting and so the House passed on Tuesday the ability for towns like Milton to participate remotely, so over a video to record votes. We also gave municipalities the ability to change the dates of their elections or town meetings in the future again. Some ability around how to use stabilization funding to pay for some shortfalls that may occur. So that has passed the House and the Senate. They're a little bit different, each version. So there'll be a conference committee put together to reconcile the differences. But the good news is that our town meeting is, I think, June 15th.
Yep.
We're obviously not in June yet. So I think there's enough time to reconcile the differences and plan on voting remotely in a safe way. So I'm really happy that the town moderator and other officials of the town have been moving that direction. I know there's been some trainings.
Yeah, I did a practice call last week. It was pretty cool what they've put together already.
Yeah, so I like the fact, the same thing, like early on, to praise the Board of Health in Milton, the Select Board and others, town manager. I got on an early phone call in March around when things were unfolding, and the strategy at that point was, we have these different sites around possible testing locations, if we get to that point, and they just, started moving forward basically right away. Yeah. And the same approach with the town moderator here, planning with, the state level, we'll catch up, we'll get that approved so that the votes are legal and everything. But, moving forward.
When they're legal.
Exactly. The safest way possible moving forward. So I think that things are being handled really well, and folks will be able to, vote on the town warrant, which is great.
Yeah.
In terms of the fall, so September 1st is our primary. So this is like state representatives, state senate, other state, and then statewide offices. So you have like Senator Markey versus Congressman Kennedy for that Senate seat and so forth. What we're looking at is, again, same kind of concept. How do we keep people safe, take precautions? Folks that either don't want to or can't, for medical reasons, go to a polling place. Mm-hmm. So there's going to be some aspect of this that's vote by mail. There's consensus, I think, building around the use of absentee balloting as a way to do this in the fall, both in September and November for the general. And so right now, things that are being debated are, do we mail everyone in the state that's a registered voter the application for an absentee ballot? So that's
like automatically.
So yeah, everyone would just get it and say, and you would be able to opt in and say, yes, please send me an absentee ballot for the September primary and the general election November. Mm-hmm. Another option is mail everyone the actual ballots, which is a little bit more complicated because of party affiliation. So the biggest question, do you mail independents all of the ballots options? And then, so there's, again, cascading effects in terms of postage and frankly, the level of crush on clerks and the Secretary of States and the folks, the Postal Service, that have to move all this stuff. So there's a lot of considerations. I think consensus is building around it. And again, my kind of emergency management background informs this, which is we want to lean on existing structures, existing systems, processes. We have absentee. Mm-hmm. We have an absentee voting process that existed 10 years ago. We now have, over the last couple of cycles, early voting. So, allowing for early voting in the primary this time around, because usually that's just available in a general election.
Right.
So again, fewer people at the polling location, safer in terms of transmission possibilities.
And less pressure on the clerks too, because it'd be more spread out.
Exactly.
Yeah.
And if we were to ask folks to sometime over the summer opt in for that absentee, no excuse absentee ballot, So you just have to say, I want it. You don't have to give a reason. Normally you would have to give some kind of
Right.
reason that you're going to be out of town,
Mm-hmm.
that kind of thing. So no excuse absentee ballot, and do that once. So
For the primary and the general.
primary and the
Yeah.
general, it simplifies the process. It makes consistency across the primary and the general. It's a lot of reasons to do it. And if you don't want to do it, you can still show up day
Right.
of, go to the polling place. So it's giving people options. And I think, again, we're still, I think we'll see that pop out in the next week or two in terms of the state level vote. We'll see where it lands.
Yeah.
I think everyone's trying to get this done quickly. But it's one of those things where it's like, we have to the sooner we get it done, the better. It helps
Right.
with the simplifying the education that might need to happen around it.
Well, that's the thing. It's not only sending out the request or the ballot or whatever it is, it's having a long runway in order to get people to figure out how they want to vote and just kind of remember that they need to vote too. I think it's really important because I don't know about you, but like there's days when I forget all kinds of basic things,
Yeah, absolutely.
wearing pants. We're pants-free household some
right.
days.
Robbie's been the leader in that, just wearing a diaper around.
Yeah.
Especially today, like when it's pretty warm out. But yeah, a lot of days have meshed together, and that's pretty natural with these types of situations. Again, I was a little bit more prepared than most in terms of my emergency management background, and
you're lucky in a weird sense.
Yeah, yes and no. But
yeah,
it was good to help folks in the early days. Like I said, I'm part of that working group for the House of Representatives, so I was able to coach folks in the first 30, 45 days. Kind of what to expect and how to pace themselves. Now I'd say, we're into the recovery, so we're kind of out of the response phase. We're into this recovery phase, which is, more noticeable in terms of reopening, I would say, in this case, talking about the phase-in reopening. But yeah, democracy goes on. So remember to vote on June 9th and then September 1st.
Yeah, thank you for reminding us about that. Before we wind down, are there any other updates, words of wisdom, pieces of advice, wear pants, I don't know, that you have for people who might be watching?
I just think it's just to me important, again, like to really think about this in terms of a couple of years of uncertainty, kind of these quote unprecedented times. Kind of the quicker that you think about how to toggle between the physical and digital presence, like I was talking about earlier, the better. We're entering this period of a very choreographed physical world in terms of pieces of tape on the ground. If you've gone to a grocery store or gone to Starbucks or anywhere else, choreographed movement, and then improv too, because some people are not on the same wavelength if you're walking down the sidewalk. And so it's just about keeping people safe, being consistent with your own personal standards and protocols, so to speak, around, wearing a face covering. One of the great reasons to wear gloves is, again, the transmission factor, but also I'm told by the experts, you're wearing gloves, you're less likely to touch your face.
Yep. That's a big reason to wear the mask too.
Reason to wear the mask.
I have fake glasses that I wear sometimes for that reason, because I didn't know this before, but I really love touching my face, apparently.
Yeah.
Like my favorite.
And so it's just continuing those practices, because this is a ultra marathon. In terms of, I'm very, very hopeful about the different work that's being done. A lot of it here in Massachusetts around, Mass Bio's membership in terms of the big pharma world, developing therapies and vaccines, but we are still months, if not years, away from that reality. And so it's still on all of us. Not only do we want to keep the curve flat, we want to render the virus just completely, flatline as long as we can.
Yeah.
And it's really, really crucial to keep going forward in that way.
Well, thank you so much. This was super, super helpful. It's always good to get an update. I feel like you gave us some information that, like secret, even though it wasn't secret, it just felt like it's coming right from the source, which is helpful because there's lots of information out there that, you know, we get hit with every day. Like you said, constant updates on the news, and it can get really overwhelming. So I really appreciate you condensing everything for us. If people want to reach out to you, how can they do that?
Yeah, so I've got a website, BillDriscollJr.com, and my email address is william.driscoll@mahouse.gov. So if you go to BillDriscollJr.com, you can get in touch. You can find updates of what we're up to. But yeah, it reminds me again to kind of, if you are separated from work, if you have, food access issues, please reach out. We're dealing with this in Milton and Randolph and across the state. So if you're dealing with any kind of state level agencies and running into any barriers, please reach out. That's part of my job and my office's job. Summer Ordaz is a great job. My staff member. We liaise all the time and try and find people answers that they're after. So there's a real delay right now, like with Department of Unemployment Assistance. And so we're able to expedite some of those cases.
That's so helpful.
And so, yeah, it ends up being helpful. We're trying to be helpful for folks where we can. And so please do reach out if you have any of those types of issues. We've heard from a lot of people, so don't be afraid or embarrassed or anything like that. The same thing around food security, food access issues. We've had a number of people that were once donors and will be again someday in the future, but right now they need to access some of the SNAP benefits that are out there through the government, or accessing food pantries, food banks, that kind of thing. So it's we're here and we can help you, point you in the right direction.
Thank you so much. And thank you again for joining us tonight. Thank you to everybody who watched. Thank you for Representative Bill Driscoll for taking time out of your busy schedule. I know that you're doing the work from home thing, and I'm sure your kids are ready to say goodnight to you. So thank you again. I wish everybody a wonderful and safe and healthy evening. Good night.